Welcome to Still Standing, where we honor the courage it takes to keep moving forward, especially for our veterans, active duty service members, and their families. Today's episode is about healing in community and how the VA healthcare system and community programs like Hope Center, which is right here in Gretna, Louisiana, work hand in hand to support our veterans. We'll explore how the VA has evolved, VA care has evolved, what resources are available today, and how local support fills the gaps, especially when it comes to suicide prevention and mental health. And I am absolutely honored to be here as both your host and a veteran, serving alongside veterans every day as a peer support specialist at the Hope Center. Joining me today, I have two leaders in veteran care. I have our executive director here at the Hope Center.
Hello, everyone. I'm Dr. Cheryl Magee-Baker, and it is my honor and pleasure to serve in this capacity to serve our veterans and their families and our active duty military.
Thank you. And we're also joined by Dr.
Okay.
Jocelyn Lewis. Please introduce yourself.
Oh, I'm sorry. Thank you so much and welcome everybody. It's an honor to be here. And I'm the healthcare navigator at Hope Center. What I do is I help connect our veterans to VA healthcare services, whether they're new to the VA or if they're returning after years away. My work includes focusing on early detection, suicide prevention, and making sure veterans know someone is walking beside them throughout the process.
All right, now. So let's begin with how the VA has changed over time. I remember when services felt harder to access and many veterans felt forgotten. Today, we see more outreach, more navigation support, and more mental health awareness. And I can honestly say I've been to the VA when it used to be over there on Perdido, and the VA, the new VA that we have now on Canal Street it's not just a new building, it's a whole new system. It's just it's a change. They're trying very hard not to forget veterans, not to leave veterans out. No veteran left behind.
That is absolutely correct. Years ago, the VA system was harder to navigate. There were long wait times, limited mental health focus, and many veterans did not know how to apply or where to start. One of the things I want to encourage the veterans in the greater New Orleans area, whether you're going in for VA medical service or mental health service, visit the facility. It is absolutely a wonderful place.
Mhm.
So you can learn about what is offered, what they have there. I go over there. I would just wish I could be in the canteen. I can't go to the canteen, but y'all have a canteen over there that I hear is fire. So, you know, do get a chance to visit, to stop in. You have veterans serving there as well. We see a major improvement as Hope Center being a partner with the VA for the last 14, 15 years. We have seen significant improvements in just coordination, and we're really working together, the VA and community partners, to serve our veterans because we know it takes more than just our VA partners and our VA staff. So there's a lot of community partners out here that are serving not only the VA but active duty military service members as well to help with whatever is needed. So, what we've seen is major improvements, including expanded mental health service. There is now a walk in clinic that wasn't so 10 plus years ago. Same day urgent mental health care, suicide prevention programs. There's suicide prevention coordinators there, peer support specialists as well, more services that are dedicated and designed for our female veterans, our women veterans. And of course, VA community partnerships, partnering with organizations like ourselves, the Hope Center. The system isn't perfect, but progress is real and support is stronger than ever. We are in meetings every week with VA staff, coordinating veterans by name, not just looking at the numbers on a page, but we are actually calling veterans by their name and walking through how we can help each veteran on an individualized basis, because we know that this is not a cookie cutter approach. Everybody's situation is not the same, and everybody needs help in a different way. And we want to encourage veterans, even though if you've had a bad experience, don't let that experience fully define and keep you from getting the help that you deserve, that you've earned, that you've worked for, that you are due. So I just want to put that out there.
I have to agree. There's even a complaint system. So if you go there and you have a bad experience, your complaint does not go on deaf ears. They actually take action on complaints. But that's so powerful how much change has happened, because especially more services that are dedicated to women veterans, because a lot of times we felt forgotten as women. Yes, I'm a soldier, but I'm a woman first. And a lot of our needs were being neglected. There's so much going on. If you go over there and ask somebody to give you a tour, nobody can tell you everything about the VA that works there because the place is so big. But as veterans, we deserve dignity, understanding, timely care, and we deserve someone to help guide us, because asking for help is hard enough. So, Dr. Baker, tell us what makes the Hope Center so unique in this movement.
First of all, let me just say, Hope Center, we're looking at the whole person. We believe in holistic services as much as we can. If we can't do it, we're going to find and connect to someone who can help, as much as possible. So we look at an individual's whole life, not just one need. And so sometimes you may feel that that's a bit nosy, but it's because we want to fill in the gaps. I can't tell you, sometimes veterans come in and they think they're coming in for one thing, but they find out that, yeah, they do need some legal services, or yeah, I need to speak with the healthcare navigation. Yes, I need to, talk with a counselor because I just had a rough day, and I need to just relax and talk to somebody. Or yeah, I want to talk with the peer support specialist. So we look at not just one need, but holistically what all of the needs are. So our services, of course, includes crisis support, suicide prevention, peer support, veteran to veteran programs, creating that social camaraderie, if I may use that term, to promote. Because sometimes when people are in a tough space, they feel all alone. And sometimes it's just help to, know, you're not alone. You're not alone. There's someone here who can sometimes relate, sometimes understand, but most importantly, patch to the help that's needed. We offer counseling and case management services, healthcare navigation, substance use, and mental health support, patching you to those resources to get that help. Housing support, as well as helping those who are re entering our society if they got into a little trouble. We're here to help and support family support services, and most importantly of all, community and faith-based healing spaces. Hope Center, let me just back up a few minutes. Hope Center is a 501c3 nonprofit organization. It's a faith-based organization born out of the Hope of Glory Church here in Gretna, Louisiana. We just don't serve Gretna, we serve the greater New Orleans metropolitan statistical area, which includes Orleans Parish, Jefferson Parish, St. Tammany, Tangipahoa, Plaquemines, and St. Bernard parishes. And even if you say, if you're listening and you say, well, I don't live in any of those parishes, or I'm not in those parishes, feel free to contact us anyway, because we have connections all over the country. We can get you to our counterparts in other part of the countries that are in all 50 states of these United States. So just wanting to let you know that our heart is behind our work. Yes, we are a faith-based organization, and we lead with love and compassion to help, to make things as good as possible. I will just tell you, I was just on the phone this morning at 7:30 a.m. with a veteran who's fallen out, a Marine, and he was just so grateful and so thankful. He said, I'm just thankful that you all are here and y'all helping us Marines. Now, I'm going to tell you, I know there's a few between the branches, but he said, y'all, we helping the Marines, but we help all branches of military. So it's not just one particular branch, but that is so rewarding. And that's one thing for me as a director, even though I may not be frontline staff or boots on the ground, the staff can tell you here that I'm at events, I'm out on the streets, I talk with veterans, I talk with their families, because we love people. We love people. We know that life has dealt some blows, and it may be from individual choices or may not be. It's things that happen, but we're here to help and patch people back to that. So we love what we do,
Yes,
and we love people, and that's why we're here day in and day out to provide that support, because we believe those who have served our country, those who have served the American citizens and protected us from foreign and domestic threats, deserve dignity, respect, help when they need it. We know that y'all fought battles that we don't even know about, but we want to make sure that we're here for you and your families to help as much as possible as we can. We may not honor, maybe not can honor every request, but we're going to do our best to help. We're going to do our best.
definitely. And I can tell you, the Hope Center does not just give you a phone number and tell you go on about your merry way, call this number. No, people at the Hope Center, the staff walk with you step by step through your process. And as someone who has walked these halls, I have been a client of the Hope Center. I have no shame in saying that the Hope Center helped me at a time when I was in desperate need. And I've seen these stories, I've lived these stories, and I've sat with veterans through some of their dark moments, some of their darkest moments, and just let them vent and talk. And once I tell them my story, they're like, "Really?" And that gives somebody a ray of hope, saying, "Oh well, if she came through and look at her now, because you can see how I ain't playing, Hey,
Yes, ma'am.
I'm trying to look the part, but I look successful because I feel successful. And if I can come through this, anybody can. And it gives people hope. So I can honestly say this place saves lives. Dr. Lewis, let
Yes.
me ask you, what does it look like when you help a veteran connect to VA healthcare?
Well, thank you for asking that, Christina. And you look lovely, I must tell you that.
Thank you, darling. Thank
Yes,
you.
ma'am. And thank you, Dr. McGee-Baker, too, for and for that explanation. That was beautifully stated. I will say it starts with actively listening, most of all. We have a conversation with our veterans. I'm not just asking, just a couple of questions, okay, and saying, all right, just like she said, Christina stated, not just saying, here's a phone number, just give them a call, and that's it. Well, first of all, I'm asking, what do you want? It's veteran centric, very veteran centric here. So I'm asking, what do you want? What is your most pressing need, especially when it comes to health care? So we help veterans apply for VA care, or if they already have existing benefits, we help them reactivate those benefits. If they need mental health or primary care appointments, we can assist with that. More than happy to help. We can also help them connect to dental care and or eye care. You do have to have 100% service connected disability to get that type of care at the VA. However, we can assist you with connecting to community health centers as well. We have a lot of veterans who state that they haven't seen a dentist in years or even decades. So that's one of the most pressing needs that we see. And they say, that's my primary need. Please help me get connected to dental care. And they've said they've had excellent results with some of our local community health centers. I'm always grateful to hear those stories too when they come back and tell us that. We also help them connect to suicide prevention coordinators. Excellent team too at the VA, must say. We work very closely with them. We also help our women veterans receive women's health resources. We also help all of our veterans navigate emergency or crisis services. And also, we help them understand disability compensation pathways. So many veterans will say, I've tried before and I gave up. It was too hard. They felt like they were alone.
Mm.
And that's where we step in and we'll say, well, let's try it again. This time you won't do it by yourself. We are here for you. And we are seeing real results. Veterans are re engaging in health care, they're receiving mental health care, and they're also feeling supported, most of all. One example that I'll share is that of a veteran who was fleeing a domestic violence situation, and she was having a mental health crisis. And together with the Southeast Louisiana VA Mental Health Clinic, excellent team, by the way, great people there, we were able to get her connected to emergency mental health care the same day. Now, I know a lot of people like, what? Seriously, we're able to get health care or mental health care in the same day? But yes, they, as
Mm.
Dr. McGee-Baker mentioned, the New Orleans VA does have a walk-in clinic, walk-in mental health clinic at their ER. They're available Monday through Friday from 7 a.m. to 3:30 p.m. You just walk in and tell them, I need to see a mental health counselor, and they'll understand. They'll make sure they try to get you assistance right then and there. With our team at the VA, our point of contact, they've been excellent with making sure, like Mr. Gary Laborde, I have to sing his praises. I just have to because he was actually able to help that veteran get patched through to services right away. You can receive, you can walk in, or should I say, you can go in person, or you can get virtual health care to speak to a mental health counselor. And he is on it. He typically responds within a few hours. And like I said, he has been great. He and his whole team have been wonderful with that. But our veteran that we assisted that day, she expressed gratitude for all of our help. And I'm pleased to say that she now has a happier outlook on life.
That's
And I'll turn
awesome.
it back over to our lovely host, Christina.
That is awesome. And I can tell you, we get stories like this often. People will call, people will write. I go through and sometimes I'll go through the contacts in my phone and call some of the veterans just to check on them, making sure everything's still okay. Do you need anything? Is there anything we can help you with? And every single time I make those types of calls, a veteran will say, I am so, so grateful for everything y'all did for me. Y'all just don't understand how much you helped me. And I have to tell them, yes, I do understand. I've been there, so I understand. And little things like that really makes the people here, the staff, feel and understand how much their work matters and that they're not working in vain. And it's the appreciation really goes a long, long way. So let's talk openly because As we all know, silence costs lives. Suicide among veterans, it remains a crisis no matter what. It remains a crisis. With all the changes, it still remains a crisis. But there is hope and support, and the support is growing. If I find more and more organizations are talking about suicide prevention. Um, More and more veterans are talking of suicide prevention. More and more active duty members are talking about suicide prevention. So, Dr. McGee Baker, what do you think about that?
Prevention starts with connection and letting veterans know that they're not forgotten, that they are deserving of healing, and there's support beyond the battlefield. Um, that is one of the things, connecting with individuals as human beings. And I think we miss a lot of that in daily life because everything is so moving so fast. Our culture in our country has taught people to be very individualistic. It's about me and mine. It's not about the greater community. I see it just in my daily travels. I make a practice personally. I'm speaking to people. How are you doing? I'm interested in you. We're interested in you as an individual. And that's not just coming from a place of just speaking, to speak. Because, here in the South, we don't dare walk by a person, even if they're a stranger, and not speak. Say hello, good morning, good evening, or whatever it is. Oftentimes I find that people just want to be seen. They want to be heard. They want to feel that they matter. That's what's important about connection. And so I want to charge every individual that's listening out there, whether you're a veteran or not, just connect with people because you don't know. Sometimes you won't know if a person served in our armed forces because they may not have on, like we all see gentlemen with their caps representing their branch of service or their clothing identifying what conflict they served in, or what type of veteran they are. They- They're not clothed like they're in active duty service. So you never know. So I always ask the question, have you ever served in our armed forces? But just speaking, being nice with a smile and just connecting with people. So that connection is paramount and is important.
Mhm. It really is.
And connecting veterans to VA care definitely increases survival. We've seen that time and time again.
Hmm.
Early access to mental health and peer support definitely saves lives as well. And we're so thankful for both of our peer support specialists, I might add. Asking for help is definitely a strength. It most certainly is not a weakness. And I always tell people, too, just on a personal note, that it is not a test of your faith to ask for help. I should say to ask for help outside prayer and your church, if you
Mhm.
attend that. There is nothing wrong with saying that I am struggling. I need somebody to assist me. I don't know where to turn. Can you point me in the right direction?
Mhm. And I tell people all the time, sometimes whatever higher power you believe in is who is directing you and sending you to the people that can help.
Exactly. I agree.
So, and I just want to say, I just want to backtrack a little bit and say that, we, even though we are a faith-based community, we do not discriminate. We appreciate. We appreciate your beliefs and whatever higher power you believe in. If you don't believe in a higher power, whichever it is. So we do not discriminate,
Absolutely, absolutely. We serve regardless.
regardless. We
We can serve
respect,
what your background is, it doesn't matter to us.
No
right?
judgment here.
Is no judgment. You're not gonna get overpowered. We hope you would see our faith in action, in the actions that in how we treat you and how we serve you.
Right, right. This has been an awesome episode because I've always said not enough people know about the Hope Center. It's I don't even remember who told me about the Hope Center so many years ago, but what we do here at the Hope Center is so, so important because so many people, everybody has a hard time at some point in their life. Everybody goes through trials. So it's not hard to ask for help if you really want it. It's not a weakness like Dr. Lewis said. It's a strength. It's knowing when you need help that shows strength and character. So to every veteran that's listening, you deserve support. You deserve dignity and you deserve connection. And I'm here to tell you that we have connection. Right here at the Hope Center, we have connection. You have the Veterans Crisis Hotline, which is 988 and press 1. And everybody always says, why you got to press 1? Well, if you dial 988, that is the National Crisis Hotline. But if you press 1, that directs you straight to the Veterans Crisis Line. Or you can text to 838-255. I'm not going to remember that. I always remember 988 and press 1. The Hope Center Incorporated, right here in Gretna, Louisiana. We welcome walk ins, referrals, and family support calls. It doesn't always have to be the veteran that comes in, it may be a family member coming in and saying, my husband and I need help. My wife and I need help. My child needs help. We appreciate your service and we want to show you how much we appreciate your service.
Yes, and on the screen is going to be how you get in contact with the Hope Center, how you can reach out to us, and where we're located. So make sure you take that down as well. We're here. And then also to reach out to us, you can also go to our website at www.hopecenterla for Louisiana.org. So that's hopecenterla.org. You served your country. Now let this community serve you.
Amen.
And remember, we're here to walk with you, not in front and not behind, but beside you.
Thank you so much for listening. Thank you, Dr. Magee-Baker and Dr. Lewis, for your time and your efforts and your hard work. And to those of you that are listening, thank you for fighting through each day. I know sometimes it gets hard, but you fight through. And I want you to remember that you're not just surviving, you're still standing. Like, subscribe, remember all that good stuff. And we will see you next time.